Welcome back to the Finding Genius video series. I'm joined with Vijay, the founder of Tomorrow Health. Vijay, it's great to have you here.
Likewise, thanks for having me, Kanal.
Just as a quick background, Tomorrow Health streamlines the process of obtaining medical equipment and supplies. Tomorrow Health raised a $25 million Series A. Congratulations, with led by Andreessen Horowitz, with participation from Box Group and Obvious Ventures, with the inspiration to scale home healthcare. But Vijay, I guess just to start off the conversation, I think what would be interesting, I read a post about how you were inspired to launch the business based off of a pretty gnarly health scare that your mother had. And this was pre-COVID, but it was still focused on respiratory issues. Could you talk, if you feel comfortable, could you talk a bit about that story and perhaps the genesis of the business, um, with regards to how the entire home health business and market has evolved in the last decade or so? It'd just be interesting to understand the broad perspective and then go a bit narrow too.
Yeah, absolutely, Kanal. Happy to start with just a bit of brief background on myself to set context and talk a little bit about the genesis for the business and, as you noted, where it fits in within the broader home-based care landscape. On myself personally, in many ways, had grown up in the healthcare world. Was born into a big family of physicians. I like to say I was pre-med coming out of the womb, but initially started my career investing in healthcare. I was at Goldman Sachs in their private equity arm, investing in healthcare tech and services businesses. And then in 2014, had the opportunity to join Oscar Health as an early employee. Was with Oscar as we scaled the business from a few dozen to about 1,500 across the team and driving $1 billion in premium revenue. With the opportunity to wear a couple of different hats, heading up the company's strategy and finance division, leading their Texas division as general manager, and then leading tenets of their clinical strategy at the national level, largely focused on starting a complex case management program to oversee and coordinate the care of our sickest and most challenged members, as well
Wow,
as innovations to transition healthcare to the home.
interesting.
And as you had noted, the genesis to start Tomorrow Health was a personal experience that I had had managing my mother's home-based care now about 6 years ago. She was a stage 3 cancer patient. Fortunately, is doing well now and in remission, but like many, had a difficult journey through it. Spent about 4 months inpatient in the ICU, about 3 months actually on a ventilator, and coming out of that, needed a year of very intensive home-based healthcare recovery. Due to the complexity of her condition, she needed a wide range of medical equipment, supplies, and services. 14 liters of oxygen, ostomy and wound care supplies, mobility and respiratory equipment, physical and respiratory therapy. And I will say, despite being in the healthcare industry myself, despite coming from a family of doctors, I could not have imagined how challenging that experience would be for us to navigate. We were sent by our insurance company to coordinate with what was nearly a dozen different medical equipment, supplies, stores, and home health agencies. I was driving out to what felt like a mom and pop shop off the side of the highway where I grew up in Pittsburgh, Pennsylvania. And you'd walk into a store, medical equipment scattered everywhere, and I'd have a prescription for a CPAP machine that just said CPAP. Turns out there's 24 types of CPAP machines. What someone with chronic obstructive pulmonary disease needs is very different than someone with sleep apnea, and yet absolutely no guidance to navigate that process for a patient or a family member. Navigating her insurance was another nightmare, spending hours faxing forms back and forth between the hospital discharge manager, her physician, the prior authorization team at the insurance company, and the medical equipment supplier. And all in, it took us about 6 weeks to get everything she needed. We ended up paying a couple $1,000s in out-of-pocket costs to get some of it faster. And due to the delays and mismanagement of her equipment, some of which was pretty critical and life-saving, including her oxygen requirement, we had to take her back to the hospital and readmit her twice in that first month, which honestly was very disruptive to her care and very demoralizing after working so hard to leave the hospital. And so it just really opened my eyes as to some of the persistent challenges that occur in the home-based care space. And what was interesting is, from that personal experience, I went back to Oscar and saw a lot of the same challenges, but from the vantage point of the insurance company. At Oscar, as we were building out our networks in Texas, we found that in every market we entered, we had to contract with hundreds of these local companies to get to network adequacy. When I was heading up our care management team, I found myself on a Friday night borrowing the phone from one of our nurse case managers, literally negotiating with some of these home-based care companies on the ground to get somebody oxygen or orthotic brace so we could prevent them from spending 2 or 3 unnecessary days in the hospital. And from our standpoint, it quickly became a top 5 member challenge, cost challenge, and ultimately operational pain point across the company. So,
Wow.
so that was the genesis for the business, but happy to pause there.
Yeah, a lot of questions just popped up out of that. But I guess, why was the process so convoluted when health systems and the shift to value-based care, they're focused on reducing readmissions? And how do they discharge your mother without really thinking about all the at-home care or setting that up in a way to kind of help with any of the issues, the post-acute care or anything that they've already set up for? Why do you think it was so convoluted in the past with managing the payers and the providers and that entire ecosystem of what's broken down? And then where do you, I guess, Oscar, you were saying was trying to start to address this, but then where did you say this is where the fine point of where we need to begin?
Yeah. It's a fantastic question. I'll answer it in 2 ways. I think the first is that one of the biggest inherent challenges with our healthcare system, as we make what is still a slow transition from fee-for-service medicine to a more value-based payment construct, is that the roles across the care delivery landscape remain extremely siloed. And so today, a patient that is being discharged from the hospital may need a myriad of different supplies and services. They may need a wheelchair, so mobility equipment. They may need ongoing recurring respiratory supplies. They may also need a physical therapist in the home. They may need infusions in a home-based setting. All of these today are delivered and managed by different vendors. And it all comes back to the way that healthcare is paid for. All of these are billed under separate and independent payment codes, and they're paid based on the site of service. And so the way this landscape is developed is in a very fragmented dynamic. And if you unpack some of these developments in the medical equipment and supplies landscape, you trace that history back a few decades. Medicare reimbursement was very generous for these types of equipment and supplies in the 80s and 90s, and it led to a propagation of small businesses. It became a very attractive small business opportunity. A couple $100,000, you could start one of these local medical equipment and supply stores. And most of these groups, as they persist today, are extremely focused on providing a really high quality of patient care. But as the landscape evolved, most of these players got the localized insurance contracts and became the primary distribution mechanism for patients to get these products and supplies. The challenge is most of them are still mom and pop small businesses. There's over 10,000 of them across the United States. The majority of them have less than $2 million in revenue and have not had the capability to invest in streamlined technology or operations to make this consumer experience more reasonable. And they have also been restricted by localized inventories, which has created this very fragmented dynamic where a patient has to work with so many different suppliers. And so from the insurance company's landscape, they may want a streamlined and consolidated experience, but the fragmentation in the landscape itself precludes that from happening. And that's where we decided to step in as Tomorrow Health. Our vision is to restore the home as a patient's primary point of care. And we do so as a platform to coordinate the breadth of medical equipment, supplies, and clinical services that patients need, such that we can bring best-in-class technology-enabled logistics and patient experience to take the fragmented journey that my mother had and make it a much more seamless and guided experience.
And are you doing that primarily through a marketplace mechanism of connecting the multitude of suppliers that you were mentioning with the providers and the patients on the other side and the payers on the other side? Or how do you think about that from just building the business?
That's exactly right. So we develop enterprise partnerships with payers, with the health insurers, that, as you noted, are deeply motivated and focused on providing coordinated care for their members for a number of different reasons. It drives a much more holistic patient experience, but also the payers who are responsible for the overarching financial costs of the medical spend for their members certainly want to keep those patients healthy at home. Treating a patient for a day at home is less than 1/10 the cost of doing so in a hospital. And so there's meaningful incentive to reduce those delayed discharges and make sure patients have the support and guidance that they need. And so we work with payers to coordinate and manage their networks for home-based healthcare. starting with
Interesting.
medical equipment and supplies. And so we're bringing together, on the one hand, physicians and hospitals that are ordering on patients' behalf, and then a range of high quality medical equipment suppliers that are delivering those products to patients every day.
Right. And I guess the way you describe the supplier market, I'm sure there's larger ones that have turned into these massive conglomerates, but the smaller suppliers that maybe have more niche equipment that are required for less well-known diseases or things like that. But how do you as a founder approach it and say these are folks that have probably never used technology before in the past? Everything's been done through paper or kind of automatic billing and worked with payers in the way that they know how. How do you, and maybe this is something that other founders can learn from, but scale that side of the marketplace when it's so fragmented? And did you approach it thinking of it from a product standpoint or more from an analysis, private equity approach of here's one fragmented side of the market and how can we consolidate a lot of it?
Yeah, it's a great question. Absolutely, from a product standpoint, and it ultimately comes back to the shared incentives that all parties have, right? Every party here in the ecosystem wants to deliver better care for patients. The referring physicians and hospitals that are placing orders through our platform want their patients to be served well, timely, efficiently, and with great visibility into when patients have received the products, supplies, and services that they need. Similarly, for medical equipment and supply companies, as I noted, most of these businesses were started out of a true and genuine care for patient care. And many of these businesses have delivered exceptional experiences for patients in the markets they serve. But it's been a challenging market to operate due to some of the fragmentation and due to some of the increasing billing complexity that has been imposed in this space over the last 10 to 20 years. It becomes a very operationally complex business to run. The vast majority of these businesses are processing the majority of their workflows deeply manually by faxing forms back and forth, by taking phone calls, a myriad of handwritten notes, which limits both their scale and the ability of time that they can focus on serving their patients. And if you
Right.
look at the economics of most of these businesses, they're generally pretty healthy from a gross margin standpoint, but a lot of these businesses suffer on an operating margin standpoint because their operating costs are so high. And
Yeah.
so that's where we look to engage with these partners, is by aligning towards, one, our overarching objective to serve the patient better, but also our ability to bring thoughtful and common sense tools, technology, and process to help them achieve their overarching objectives.
Right. And I guess the obvious question that I'm sure you get asked quite a bit is when COVID started, how did your business evolve through that? How did managing it as a CEO change your perspectives on running a company? Could you talk a bit about that side and just your learnings of running a healthcare business during the pandemic?
Yeah, absolutely. I'll answer it in a couple of different ways. The first is that even prior to COVID, there were huge amounts of patient need in this space for all the reasons you mentioned, right? You had this overarching shift to home-based healthcare. 90% of senior citizens wanted to age in place. Given the shift to value-based care, that was an ongoing trend from the system. But there's no question that COVID prompted a huge amount of need in the market, right? All of a sudden, you had 300 million Americans that were homebound. 7 out of 10 were managing a chronic condition. And you had the entire senior population, in addition to, younger able-bodied folks like us, the entire senior population, folks with disabilities, who needed access to critical equipment and supplies. But as you saw this spike in demand, you also actually saw a contraction in supply, because most of the organizations in the space were retail-based, were a bit more localized, didn't really have the capabilities to support patients and their families with the logistics and the supply chain that was needed around the home-based setting. And from our standpoint at Tomorrow Health, actually, our company had not formally come out of stealth as of yet. We were serving a range of patients for some time when the pandemic hit, but it became clear to us from the stakeholders that we served, from hearing from patients the challenges that they were having getting the equipment that they needed. We hearing from payer partners around the complexities of even just getting prescriptions authorized when many physicians weren't near their fax machines in their office.
Right.
And what could be done to streamline this. And so we actually accelerated our company launch about 5 months and kicked off right at the beginning of the pandemic, ultimately with the goal of just making folks aware of our service and letting as many people know across the country what we could do. We were at the time licensed in about 3 states. Within about 2 months, we expanded that licensure to about 29 states. And very, very quickly, we saw a huge amount of demand for what we were providing. And that came from a plethora of patients who were in need, as well as other partners, both payer partners, providers, and government agencies. Early on in the pandemic, we created a partnership with the New York City Mayor's Office to be the city's preferred provider for medical equipment and supplies for the city's seniors. Every week, they would deploy tens of thousands of health risk assessments to seniors in the city that were isolated. And for those who needed medical equipment and supplies, Tomorrow Health was the supplier that provided that. And so, we saw a tremendous amount of need and expansion of the surface area of the business as we really worked to service a wide range of partners. And that has only accelerated today. Today, we serve over 125 health plans at the regional and national level. And we've been fortunate to serve tens and tens of thousands of patients on a weekly basis, across which we've been able to deliver an over 95 NPS score. And so that's something that's really important to us. But the second way I'll quickly just answer your question is being a CEO, being a founder during this time. And so much of what I was focused on was as we were looking out in the market and seeing a lot of the challenges that folks were experiencing, our customers, recognizing that many folks on our team were navigating those same challenges, having elderly loved ones for whom they needed to provide care, the tremendous amount of uncertainty that we were all navigating through. And at the same time, having this tremendous need from our base of customers. And I will say it was a period that really brought us together as a team, fundamentally aligned behind our mission. Our first value as a company is to fight like hell for patients. And we recognized that this was a time in which we could embody that value in our mission more than ever before. And it was inspiring for me to see the way in which folks across our team, from engineers who are working around the clock to deploy new products to enable us to scale, to our care advocates that were doing weekend shifts to facilitate discharges for patients with oxygen, given that spiked over the months of the pandemic, was really incredible and something that has been a lasting tenet of our culture as we've gone through.
That's very interesting. And I know we're only a few minutes left, so I'll try to squeeze in some rapid questions here, but you were on Wall Street, you were investing in healthcare businesses, you went into Oscar, saw opportunities there of where in healthcare there still may be some shortcomings, and then you decided to commit and actually launch a business. Is there a process that you use of saying, here's an idea that I want to test, and here's how I'm going to validate it? And I think probably your own personal experience has also helped to validate that this problem is real. But are there kind of solutions or ways that you would advise other founders who might have been in those roles of seeing the entire market and then identifying opportunities, of saying there is a potential business here, and then actually communicating that to funds such as Andreessen, which are the best, and then how you get them on board to buy into that vision also, I think would be just an interesting story for other founders to learn from.
Absolutely. The biggest thing I'd say is it has to stem from true understanding and passion for a problem. I know plenty of folks that came from either professional services background that have looked at markets and tried to identify vertical or horizontal market opportunities and build a business around that. But I think the truth, and especially in an industry that is so complex like healthcare, is it has to be deeply rooted in a real patient problem, and it has to be a need that different stakeholders want to solve. And this is universal across all founders, across all industries. This is a long journey, and you really, truly have to care about the problem you're solving, because you're committing your life to it for a meaningful amount of time. I'd say in terms of that process for me, when I was at Goldman, what was actually interesting was it was the tying of the bow that Obamacare was happening. Obama had won re-election. It was very clear this transformative legislation was happening. I actually got staffed on a small team that was tasked with assessing what the law actually did, how it impacted every subsector in healthcare, and how we could position ourselves from an investment standpoint. And so I actually sat down and read the law end to end, which candidly, I'm not sure that too many congressmen or senators have actually
Yeah,
done.
right.
But I'll say, you take the lens of somebody that really truly cares about innovation in the healthcare system, and you can see in every chapter of that law dozens of opportunities, right? And for me, it was so clear that this was a point in this ecosystem in an industry that I had cared so much about growing up, planning to be a doctor for so long, that I could impact at scale in a different way. And from there, I had the fortune of getting connected with Josh and Mario at Oscar when the company was still in stealth, and really just admired the big, bold vision that they had to transform this segment and how health insurance could be used differently. And just signed up, came along for the journey, and said, "Hey, these are the things I'm interested in, but put me where I can be the most helpful," right? And
Right.
I will say it was really that experience building and scaling within the industry, right? Shifting from waxing and waning in investment committee about value-based care and these trends to actually seeing it on the ground, right? Sitting across from a hospital CFO and trying to navigate an arrangement to upside or downside risk, or actually being in the clinic with patients and seeing the challenges they had navigating their insurance complexity. That was what really opened my eyes to what it actually takes to drive real change in an industry like this. And it was that context combined with a true, I would say in many ways, fire that was created from experiencing this problem firsthand that was the genesis for the business. And so to other folks in a similar space, I would say, look for the problems and follow the ones that you're most passionate about and do everything you can to understand them. Talk to hundreds of stakeholders across the ground. And it is from that the genesis of the best business ideas, I think, will be born.
Interesting. And I guess you read all of Obamacare and all the legislation, but as you get deeper into healthcare, what are you doing now to stay abreast of how laws are changing and where there might be opportunities for Tomorrow Health in the future, as maybe perhaps you continue to expand beyond DME, or if that's even a plan? But how do you stay abreast of trends? And is that in the rooms of the CFOs of the health systems and patients, or are there other ways that you would recommend folks do it?
Yeah, yeah. It's a deeply complex and interconnected industry, and it's one that you noted that sits inherently at the intersection of policy, regulation, clinical practice, and technology and innovation, right? And so it's ultimately about bringing each of those pieces together. And I'd say one of the things that we've done at Tomorrow Health to stay ahead of these trends is to really build a diverse team and base of advisors that can bring those perspectives to us. And on the policy side, we've been able to work with some exceptional folks. We've brought on Eric Hargan, who was recently the Deputy Secretary of Health and Human Services, Paul Mango, who's the Deputy Chief of Staff for CMS and for the Health and Human Services Department, ran McKinsey's healthcare department for about 20 years, that have provided to us just really a tremendous perspective on the landscape and where the puck is going from a regulation standpoint. And having a view into, okay, how is this landscape going to shift, and how can we continue to orient and expand our business to continue to drive value for stakeholders as this landscape evolves, right? And so in an industry like healthcare, to build a business of meaning and consequence to the industry, you have to be deeply plugged into the policy. And what's different in this space is it's not just at the federal level. It is at the state level. It is with privacy regulations around data and access, like HIPAA and high tech, and really staying active on that. But I would say combining that with a view constantly as to how can you innovate within where those boundaries are set, and never taking the status quo as fixed. Which is something that I think too often creates a lack of inertia in this industry.
And can you give us, as the last question, can you give us some thoughts on where does Tomorrow Health go in the future, or are you hyper focused right now and continue to expand and build this marketplace and own and dominate that side of it? Or are there other areas where you see opportunities in partnership with more of the digital health solutions that are there that don't have connections with the in-home care?
Yeah,
How do you think about that?
yeah, absolutely. So again, coming back to our ultimate vision for the business, it's to restore the home as a patient's primary point of care. And we want to build Tomorrow Health into a platform that can provide that trusted guidance that we wanted when my family was in the same situation, right? And we want ultimately to achieve a position where people think of Tomorrow Health in the way they for their healthcare and their home-based care, the way they think about, for example, Uber for transportation, right?
Right,
People walk
right.
outside of their home, push a button on their phones, turn to Uber as this comprehensive logistics platform to get them from A to B, leveraging a different set of transportation mediums. In the same way, for patients who are either coming out of the hospital or managing ongoing chronic conditions, we want them to turn to Tomorrow Health as that trusted partner that can coordinate all of that seamlessly for them with technology, logistics, and personalized service. And the one layer on that I'd add that's a bit differentiated is that all of it be coordinated and embedded within their insurance benefits, such that it's affordable. And that's where I think a lot of the challenge in this industry lies, is there is a tremendous amount of complexity with working insurers, but it's an area where we've focused our efforts from a technology and logistics standpoint to really unlock both that opportunity and that value for patients. And so there is, as we see it, a tremendous amount of opportunity for collaboration and partnership from both digital health solutions as well as a plethora of home-based care delivery organizations that are looking to kind of access some of the rails and some of the infrastructure that we've built, both to access payer reimbursement, but also to be a part of that ecosystem to serve patients more holistically.
Great. Vijay, thank you so much. I appreciate the time. Sorry for running over a little bit.
It was an absolute pleasure. Thank you, Kunal.
Thank you.